Hi, my name's Tara Winward. I'm going to be doing the subcutaneous injection. So first I would verify the order. The order is heparin, 10,000 units per 10 mLs. The order is 1,000 units, sub-Q 1 dose. So I would verify the order, verify the 6 rights, which is right patient, right medication, right time, right dose, right route, and right documentation. Then I would gather up my supplies and I would head down to my patient's room. When I get there, I would knock on the door, provide privacy, introduce myself. Hi, my name's Tara and I'm going to be your nurse today. I'm here to give you a heparin shot. I would let them know that heparin is to avoid, prevent and treat blood clots. The side effects could be stomach pain, back pain, blood in the urine, joint stiffness, headache. If any of those affect you, contact your doctor. And then those are also the adverse effects. When I give the injection, you may feel slight burning and stinging. And then I would allow the patient to ask questions. I would perform hand hygiene. I would glove up. Okay, so let me grab a different pair of gloves. Okay. Cool. Okay, so first I would start by cleaning the top of my bottle with an alcohol swab to avoid contamination. Next, I would open my needle. Actually, before I do these, I'm going to assess my patient's skin. So this is going to be my patient's abdomen, about 2 inches from the umbilical area. Ask my patient which side that they had their last injection on, because I want to rotate sites and not do it on the same side every time. When I palpate the skin, I'll make sure that there's no bruising, lesions, tenderness, or any masses. If there is any masses or anything, I would rotate to the other side to avoid the masses. And then I might also look for like edema. If my patient's good there, I will use an alcohol swab, clean the patient's skin from the inside to the out in a circular motion. While I let that dry, I will then clean my alcohol swab with a new alcohol, or clean my top with a new alcohol swab. Open up my needle. So like I said, I'm going to do 1,000 units. So 1,000 units out of this, because this is 10,000 units per 10 mLs, I'm going to do 1 ml. I only need 1,000 units. So I would pull back the air, inject that into my bottle, and then I would pull back. One ml. So there is 1 ml. Make sure that there's no air bubbles, of course. All right. So then I would pinch the skin in the area that I was going to do it. I'm going to put it in 90-degree angle, like I'm throwing a dart. And then I'm going to get the medication in quickly. Oh, I would have released before I pushed that in. Push the medication in quickly. Hold my gauze. Activate my safety. Make sure that there's no bleeding or anything after giving the medication. And then I would remove my gloves, put this in the sharps container. Well, I would have done that before I took my gloves off. But I would have discarded my needle, took off my gloves, performed hand hygiene, cleaned up my mess, and then document the procedure. Thank you.